Good afternoon. I am registered nurse and my name is Aruna Banjara. Uh, uh, what is your name?
My name is Chungda.
Uh, okay, I saw your report and your diagnosis with tuberculosis. Today I am going to give some health educations about tuberculosis. Do you know what is tuberculosis?
I think it's a bacterial infection that affects lungs.
Yeah. Tuberculosis is caused by the Mycobacterium tuberculosis, which is transmitted through inhalation of the aerosol droplets, and tuberculosis mainly attack the lungs, but also can invade the other parts of your body. Um, Tuberculosis is contagious during the active stage of the disease and can infect the individual inhalation 10 times that the Mycobacterium tuberculosis, which is bacteria. Uh, when this bacteria is inhaled, then these bacteria are mainly captured to the alveolar macrophages, but they can invade in the immune system and remain in the dominant stage for a long period of the time. At that point, they can reactivate and variant from under the immune compromised condition of the host. And this is only possible because when the Mycobacterium tuberculosis is persistent in slow growing as well as in the fast growing stage, which makes the treatment more challenging. uh, okay, Chundak, do you know what are the signs and symptoms of the tuberculosis?
You have sweat,
Yeah.
fever,
Yeah.
and sometimes chest pain.
Yeah. There are coughing.
Coughing, yeah.
Yeah, coughing that persists for more than 3 weeks, 2 to 3 weeks, and when you cough, there you can see there is the blood or mucus in the coughing, and there is the chest pain for the longer period of the time, and fatigue, fever, sweats. Especially at the night time, you have the sweat. Then chills and loss of appetite are the main symptoms of the tuberculosis. Chundak, do you know how do you diagnose the tuberculosis?
I think by chest X-ray.
Yeah.
And Mantox test.
Yeah, mainly tuberculosis is done TB skin test. That is the main diagnosis, and tuberculosis is identified by the blood test. These two through these are the main tests which helps to diagnose the tuberculosis. Uh, um, then, do you know how we can treat the tuberculosis?
I think they have drugs, medications.
Yeah.
First line medication, second line.
Yeah, there are the different kinds of treatment of the um, uh, tuberculosis. You can see here I have made some pamphlets. There are first line drugs, second line drugs, and there are some injectable drugs. Then treatment isn't always required for those without the symptoms. Patients with the active symptoms will require long course of treatment, including multiple tuberculosis, multiple antibiotics. Okay, you can see here. Here are first line drug and second line drug. In first line drug, rifampicin, thiambutal, paraginamide, and streptomycin. We are using those drugs as a first line drug. And second line drug is ofloxacin, ribofloxacin, and ciprofloxacin. These are the second line drugs. And also there are some injectable anti-tuberculosis drugs. There are kanamycin, amikacin. These drugs are given as injectable anti-tuberculosis drugs. And there are also less effective second lines anti-tuberculosis drugs. They are trizidone and cyclosporin. These are the less effective. Then Chundak, do you know when to see the doctor? Do you know when you want to see the doctor after you are having some kinds of symptoms like tuberculosis?
When I have chest pain, a very bad pain, and cough, blood in my cough.
Yeah, actually, when see your doctor when you have a fever, then unexplained weight loss, then when there is a night sweat or a persistent cough is there, and these are often indication of the tuberculosis, but also can result from the other conditions, but you have to see the doctors if you have these kinds of symptoms. The Center for the Disease Control and Prevention recommendations that people are having the increased risk of tuberculosis screen at the latent TB infections when you have the HIV/AIDS, use of IV drugs, and is contact with the infected people. So if you have any questions related to the tuberculosis, you can ask me.
Oh, thank you so much. I got enough knowledge about tuberculosis. Before I did not have enough knowledge, but after your health teaching, I think I know more about tuberculosis.
Okay, Chundak, these are the some introductions as well as treatments and diagnosis of the tuberculosis. Then I think you got enough knowledge. Then if you have any queries, then you can ask me at
Yeah.
any time. Thank you for your time.
Thank you so much.